Faith Kipyegon underlined her status as a legend, claiming her fourth global 1,500 meters gold, her third in a row, before adding silver in the 5,000 meters. Faith Cheprotich reclaimed the 300 meters steeplechase crown for Kenya for the first time since 2019, setting a new championship record, while Paris Jepchirchir struck gold in the women's marathon, ending Kenya's drought in the event since Ruth Chepngetich victory in 2019. Lilian Odira stunned the world with a record-breaking run in the 800 meters, smashing the longest standings championship record set in 1983. Right, congratulations to Team Kenya for their stellar performance in the athletics in Tokyo, Japan. Right, moving on to matters politics, UDA parliamentary aspirant, that is, former Lava constituency, Ryan Injedi, has conceded defeat in the party's by-elections while accusing Prime Cabinet Secretary Musalia Mudavadi of influencing the outcome in favor of his rival David Ndakwa. Now, the party primaries saw Ndakwa, the former West Kabras ward representative and minority leader in the Kakamega County Assembly, clinch victory with 8,756 votes against Injedi's 6,312. Now, speaking in Lugusi, Kakamega County, Injedi said that despite his disappointment with the process, he will continue to support President William Ruto's government and work for the unity of the Malava community. He alleged that Mudavadi was involved in schemes of favor Ndakwa, but maintained that he would respect the will of the people as expressed in the polls.
Ndampatia nafasi mzee Ndakwa atafute kura Malava hii. Na mimi bado nitasimama na serikali, nitasimama na Mheshimiwa Ruto. Ile mbali tuambia kule State House bado niko nayo na nitaendelea hivyo. Na nikukumbusha tu watu wa Malava. Watu wa Malava tumezoea serikali. Na nakuomba wewe Mheshimiwa Ndakwa, umepigana vyenye umeweza ni ukapata tikiti. Sasa ni jukumu ni kwako kuhakikisha kwamba watu wa Malava wabaki ndani ya serikali. Usiwa let down, usiwafanye wende mrengo mwingine au wende pande nyingine ya opposition ili hali wamependa kuwa serikali. Mimi ndio nilikuwa kiboko ya hawa watu opposition, lakini wewe na watu wengine mmepanga MCAs wote ya kwamba wewe ndio utakuwa kiongozi. Tulikuwa na Mheshimiwa Prime Cabinet Secretary Musalia Mudavadi. Tukataka tuelewane. Lakini kwa maono ya rais akasema tuende kura ya mchujo. Na hii wakati yote sijaona mkono wa rais mahali popote. Sijaona mkono wa Faruk mahali popote. Sijaona mkono wa mtoto wa serikali, hata wenye chama wa serikali UDA. Sijaona mkono wao mahali popote kujaribu kusaidia mtu fulani. Lakini cha kushangaza, watu wa ofisi ya Prime Cabinet Secretary, nini hii kubwa mlikuwa mnataka kufanya nyuma Malava kupiga kijana mdogo kama mimi? Mbona mko wa Malava wafanye uchaguzi kivyao? Mheshimiwa Prime Cabinet Secretary, mzee alikuwa rafiki yako. Wakati wa earthquake ulitorokwa na kila mtu, wakabaki na mzee peke yake. Nini hiki kubwa ili kufanya wakuja hapa kutatiza siasa hii ya Malava? Kura ambayo rais amesema watu wa Malava wachague wenyewe. Nini likutuma? Wakina Buchichi, najua. Watu wote niseme yule sema huyu alikuwa anaonekana kila mtu anatembea na muona. Tumekubali, lakini atasahau. Watu wa Malava wameona na watasahau.
Right, now let's talk matters education. And Kenyan publishers are urging the government to clear pending debt of 3 billion Kenyan shillings owed for the supply of grade 9 textbooks and the rationalization of lower primary books. Now, speaking ahead of the rollout of the grade 10 curriculum next year, the publishers said the unpaid debt is straining their operations and could affect the timely production of distribution of learning materials. Now, the Kenya Publishers Association noted that despite the financial challenges, they're ready to supply textbook for at least 35 learning areas for grade 10 learners in 2026, provided that the government honors its pending payments.
We have said as a Kenya Publishers Association that we are very optimistic that this payment will be done. We have been in discussions with the government. We have explained the challenge that we face as publishers, the challenge that our service providers like printers, distributors, among others, also face to enable the supply, seamless supply of grade 10 books. So we are very certain that the payment will be done. We will pull all stops as publishers to ensure that we do print and supply these books for grade 10.
Alright, still matters education. Junior secondary school teachers in Kakamega County have raised the alarm over what they term as systematic neglect and intimidation by primary school heads demanding full autonomy to manage their own affairs. Speaking under the banner of Kenya Union of Post-Primary Education Teachers, that is KUPPET, the teachers accused primary school management of creating a hostile working environment that is undermining the effective rollout of the competency-based curriculum. And according to the KUPPET officials, the current administrative structure leaves JSS teachers reporting to primary school heads, which they argue diminishes their professional independence and frustrates service delivery.
There is a lot of discrimination, victimization, and every vice ambao ni mbaya zaidi on these teachers. Teachers are suffering. When we just quote on the issue of enhancing the issue of medical cover, I want to let Mr. President know this. He is not getting this power better because of teachers at large. He is getting that cover for the JSS teachers. Because these teachers are going through psychosocial issues, emotional issues. Here in Kakamega, we have lost about 10 teachers whom we perceive that is about depression.
The language is autonomy. We are demanding for autonomy for our brothers. JSS schools are supposed to be independent. When we went to see the president, that was issue number one that was taking us there. There is no way we shall continue crowding our graduate teachers in the primary sector. As Secretary Gender, I've solved so many issues of primary school teachers, of JSS teachers clashing with HOIs because somehow they just don't understand each other. Let us give JSS teachers their rights to be where they're supposed to be. Let them be in their own school. Give them their own space to operate. Let JSS schools have their own BOMs, have their own structures. They need laboratories. They need structures that are deemed fit to ensure that they deliver. And if we continue cramming them in the primary schools, then we are not going to achieve what we are supposed to achieve in the new curriculum.
Shule za sekondari msingi zipate uhuru, ziweze kujisimamia. Kwa sababu wakati tunazungumza kuhusu shule hizi kuwa katika shule za msingi, inaleta kwamba kuna ule mgongano wa usimamizi wa mamlaka na mambo ambayo yanafaa kufanyika hayafanyiki. Kwa hivyo tunaomba kwamba shule za sekondari msingi zisipelekwe kwa shule ya upili na zisiwe katika shule ya msingi. Tuwe shule huru ambayo inaweza jisimamia, ndiposa mtaala ambao upo mpya ukaweze kutekelezwa. Tunaomba ya kwamba serikali yetu tukufu iweze kutusikia na walimu hawa wako tayari kufanya kazi.
Our fight right now is autonomy. When we get autonomy, we get the power to control these schools. We are able to fight for our rights. Watu ambao wanakuja wanaongelea kuhusu teacher shortage, hawaoni shida yenye iko kwa ground. Shida ni mwalimu na mwanafunzi na mahali penye tuko. No, hakuna enough resources. You know, when they wakituweka independently, this is a secondary school.
All right, moving on, the Ministry of Health has urged stricter enforcement of tobacco control laws in response to the rising use of tobacco and nicotine products, particularly among the youth. Now speaking in Kirinyaga during an engagement with religious leaders, Public Health Principal Secretary Mary Modhoni expressed concern over the growing prevalence of tobacco consumption among young people, warning that the long-term health risks and societal impact. Now, the PS called on community leaders, faith-based organizations, and law enforcement agencies to work closely with the ministry in sensitizing the public and strictly implementing existing tobacco control regulations.
That tobacco is very, very addictive. It is expensive. It is deadly. If you look at one electric cigar today, it will cost you not less than 3,000 shillings. How many youths will afford 3,000 shillings at any given time to get the puffs that they want? So they'll end up stealing. Shisha dens and all that, we should ensure that we enforce, because I reiterate, shisha is banned in this country.
Right, moving on, President William Ruto has reiterated his administration's commitment to ensuring that every child in Kenya has access to quality education, describing education as the key to national empowerment, equality and prosperity. Speaking in Nairobi on Saturday during a fundraiser in support of Islamic institutions in Mandera County, President William Ruto said the government is determined to break barriers that hinder children from going to school, particularly in marginalized regions. The head of state commended the El Tabashi Educational Trust for its tireless efforts in supporting vulnerable children in northern Kenya, praising its role in promoting opportunity, progress, and national unity.
Matters education are important to all of us because ignorance and lack of knowledge limits the potential of people and countries. So the more education is made available to citizens, the better we become as a nation. And it is the reason why we have invested a lot of resources in matters education. We have hired more teachers, we've put more resources, we've built more classrooms, we have straightened CBC, because knowledge is important. And I am very happy that even we are thinking about madrasa and how to make them sustainable. This event of making the teaching of religious teachings sustainable goes a long way. Along the same lines, we are consolidating the place of education in our country because it is the single most important empowerment that we can give to this generation and to the generations that come after us, education. And so I want to say congratulations to the people who are putting this together. Empowering communities, empowering citizens through education is one of the best and the single most important means of creating prosperous nations. On matters equity, on matters making sure that we do not have unfairness, we do not have prejudice, we do not have others thinking that there are greater and lesser Kenyans. That going forward, as I said when I was in Wajir, we are citizens of one nation with equal rights as citizens of Kenya. And it is my responsibility as the leader of this nation, by God's grace now, to make sure that no part of Kenya, no community in Kenya, no religion in Kenya is lesser or greater.
Right, President William Ruto has arrived in New York, United States, to attend the 80th session of the United Nations General Assembly, where he will champion reforms in global governance, fair development, finance, and stronger climate action. Speaking ahead of the high-level week of the Assembly, President William Ruto said he looks forward to advocating for a restructured global financial system that guarantees fair access to development financing for developing nations. He also emphasized the need for more inclusive United Nations that can effectively address pressing peace and security challenges around the world. During his stay in New York, the president will attend several high-level events, including a Committee of 10 summit, that is C10, where he will push for Africa's position on UN Security Council reforms. He will also advocate enhanced peace efforts in Sudan, South Sudan, and Democratic Republic of Congo, Somalia, and Haiti. Right, 15 minutes past the top of the hour. That's not to wrap up, or rather we'll take a short commercial break here on the program, but we'll be back in just a bit. Right, welcome back to the program. You're watching EBN Weekend Edition. Moving on, Bomet Governor Professor Hilary Barchok has urged Health Cabinet Secretary Eden Duale to push the Social Health Authority, that is SHA, to release funds to hospitals on time, warning that delayed payments are crippling health facilities that rely on money to buy medicines and essential supplies. Speaking during the launch of a modern AI-enabled digital X-ray machine at Cheptalal Sub-County Hospital, Governor Barchok stressed that timely disbursement of funds is crucial to ensure uninterrupted service delivery in public hospitals. Now, the digital X-ray machine, supported by PEPFAR, that is HJFMRI, and the Walter Reed project, is expected to boost tuberculosis, that is TB detection, and enable portable diagnostic services for patients in rural and remote areas.
Through the support of the American people, the new administration under Trump, finances have not been flowing as we expected. And in fact, as we are speaking, some of them have been stopped. But as Bomet, we have put measures in place to ensure that the programs that were being supported through PEPFAR will continue. Through our assembly, we've been able to budget money to support staff and to support those programs that were being funded by PEPFAR.
Patients are always referred to the nearest facility where we can take the X-ray images. But going forward then, we'll be able to have a robust medical camp where the X-ray images can be taken, they can be interpreted, and the patient can get the right diagnosis right under a tree or under a tent in a place where we'll be having these medical camps. So this is one of the best technologies that we are going to deploy, and this will actually improve the services and other equipment and the technologies that we are leveraging on.
Right, still matters healthcare. Aga Khan Hospital in Mombasa, in partnership with the East African Comprehensive Women's Cancer Project, on September 20th marked World Gynecologic Oncology Day with a public awareness event focusing on prevention, screening and treatment of women's cancers. The initiative, funded by the French Development Agency, the Bill and Melinda Gates Foundation and the Aga Khan Foundation, is being implemented in Kenya and Tanzania. Now, in Kenya, the program targets Kilifi and Mombasa counties at the coast, as well as Homa Bay and Kisumu counties in the western region. Aquinas Mungatia, head of project at Aga Khan Hospital and project manager for the Women's Cancer Initiative, highlighted the initiatives being undertaken, including HPV vaccination, cervical and breast cancer awareness campaigns, screening and infrastructure supports.
In Kenya, we are operating in coastal region, that is Kilifi and Mombasa County, and in western region, which is Homa Bay County and Kisumu County. In coastal region, we are doing HPV vaccination, we are doing cervical cancer, breast cancer awareness. At the same time, we are doing screening, and we are also supporting Kilifi County in building a chemotherapy treatment room, which will be actually the only treatment room in Kilifi County. Alone, we have gone out to schools and did vaccination to over 25,000 girls of 10 to 14 years. So, and this is a project that will continue for the next 4 years. Coastal region has been lagging behind with the girls getting HPV vaccination. So as a responsibility, we want to go to the communities, go to the schools and get these girls vaccinated. Number two is we have 2 of these mobile trucks that will be equipped with equipment just to be able to treat those small minor lesions in the community out there. So we are going out there every day working with the Department of Health to do the screening in the community to create awareness to sensitize people. At the same time, when we do the screening for those small lesions, we treat for those ones, major ones, they will come back now to our specialists to look at them and look at them to the far end, to the palliative care aspect. We are not looking at just screening, treating and leaving the patient. We are looking at screening, treating and carrying all through the process. So out of the 20 women we screen out in the community, we get around 2, 3, 4 suspicious cases, which now we refer for further tests, because suspicious doesn't mean somebody has cancer. But on the community for us is to check whether there is anything suspicious or abnormal, so then you can refer to the specialist to confirm through other methods that for sure this is cancer or not?
We have about 5,800 new cases of cervical cancer that are diagnosed every year, and out of that we have about 3,800 women who die from cervical cancer. In terms of where cervical cancer ranks in terms of death, that's mortality, it is the leading cause of cancer-related death amongst women, overtaking even breast cancer, ovarian cancer, and all the other cancers. In the coast region, we are also seeing quite a high number of cervical cancer. In fact, if I see 10 patients in the clinic, 8 of them will have cervical cancer. In terms of data, we still are collecting lots and lots of data to find out exactly how the disease is affecting us. The one problem that we have in the region is misinformation. A lot of people think that because cervical cancer has been linked to HIV or because it's related to HPV, which is a sexually transmitted infection, it creates a lot of fear, a lot of stigma.
Right, now let's get sporting. Divers from Bandari Swimming Club and Blue Ocean SC emerged as the top performance during the MCSA Innovational Swimming Championship held yesterday at the Aga Khan Academy Swimming Pool in Mombasa. Now the two clubs dominated the boys and girls 400 meters freestyle events, sharing top honors across various age categories. Bandari CS topped the medal tally, collecting 4 gold, 1 silver and 1 bronze medal. Blue Ocean CS followed closely with 3 gold, 1 silver and 2 bronze medals. Host Aga Khan Academy managed 1 gold and 1 silver medal, while USIU Dolphins and Otters CS took home a gold and bronze medal each. In the boys 16 to 17 years category, Bandari CS Riyadh Abubakar clocked 4 minutes 38 seconds and 64 milliseconds, while Abadeli Aidan of Blue Ocean came second with 6 minutes, 12 seconds and 85 milliseconds. The men's 18+ category saw Blue Ocean's Samir Bechalani touch first in win 4 minutes, 37 seconds and 64 milliseconds.
We had a very good turnout thanks to all the parents, the swimmers and the stakeholders. And we hope to, this is one of the final events of the season, and we have had good results so far. We have 2 teams from Nairobi, one is USIU, the other is Otters Swim Club. And the rest are all, there's a lot of support from the Mombasa stakeholders and the clubs. So, yeah, we are doing very well and hope to continue the same. We make an earnest appeal to the county government and to all stakeholders who want to come forward. We have always needed a 50-meter pool, an Olympic-sized pool, in Mombasa or in coast, which will give a very big boost to the athletes and to the people involved as well. So that's the kind of appeal we want to do to the government, to the county government, to please step in, come on board and support us financially, morally, so that we can go for it's for the cause of it's for a good cause for the betterment of the swimmers, for the athletes.
Right, it is exactly 28 minutes past the top of the hour. You're now up to speed with us making headlines from across our 47 counties and, of course, in the world of sports. All right, it is exactly 28 minutes past the top of the hour. That note, we wrap up our program here on EBN Weekend Edition. My name is Martin Macharia. Many thanks, of course, keeping me company until this particular minute. Do have yourself a good night, and as always, let's do this again